today we are going to deal something about the dosage forms. Dosage forms are the one through which we are going to administer the drug. So it is the physical form in which a drug or the medication is compounded for administration by various routes to produce desirable pharmacological effect. So am I audible to everybody? Am I audible?
Yes, sir.
Yes, sir.
Okay, then. So dosage form means any form of the medicine through which the drug is administered to the animal or the human being. That's known as the dosage form to bring a what you call as the desirable pharmacological effect. So to deliver drug in convenient, painless and acceptable manner, that's very important, and also to facilitate the absorption of the drug in predictable and desirable manner, because whenever a drug is administered into the body, it should be absorbed to a greater extent. That's one of our important aim is concerned. Then the dosage forms are prepared in such a way that the maximum absorption should be there, and to deliver active principles in a stable form means the drug should not be decomposed, or it should be very stable form. That's the one of the aim. And to deliver drug at target site means, suppose there is a mastitis in a cow, the target site is the cells which are producing the milk. So there the drug need to reach. So that's known as the drug delivery system. Here the example is given as enteric coated tablet, means suppose we are going to take certain drugs like pantoprazole or omeprazole. Hope you know these very common drugs which are administered to reduce the acidity. So such type of the drugs are given with enteric coated because the gastric acid is going to destroy the outer coat of the drug. Hence, you can prevent this one. And the another aim is to provide protection against moisture, light and atmospheric oxygen. So whenever you are exposing the drug to the environmental temperature, there is a chance that the drug get decomposed. Hence, because of this thing, the sometimes the coated tablet and capsules are being prepared, and also to provide protection against gastric acid. The same thing, the enteric coated tablets, many are gelatin coated tablets, and enteric coated tablets means whenever this drug is in the gastroenteric system, it should not get destroyed by the gastric acid. That's the very specific aim of this particular coating, etc. Then another aim of the dosage forms, suppose the tablet or any other drug is having very bitter taste or nauseant odor of the drug, then they are made as a capsule. Then another aim is to make the good taste or flavor of a particular drug, and to mix two immiscible substances, for example emulsion. So there are two types of the drug forms which cannot be mixed easily. Then they are mixed into the emulsion, and to provide long shelf life. Suppose the drug is having a expiry period, so this can be extended by using certain materials. So to store the drug for longer shelf life, shelf means to keep in a shelf and the life, and to provide uniformity with respect to drug contents, means there should be uniform. Suppose in one tablet 10 milligram is there, in another form it should not be degraded to 5 milligram. So to maintain this thing, a dosage form is maintained, and also to provide extended drug action through controlled release mechanisms. So a controlled release means a known quantity of the drug need to be released at a unit time. So especially the implants and pellets, they are prepared in such a way that a small quantity of the drug is released into the system, then it brings the action like this. Then here you can see the medicine or the drug or active pharmacological ingredient. Yesterday Sunil has told what are all the active pharmaceutical ingredients, just like the chemical name, the generic name and the trade name. Here the active pharmaceutical ingredients plus excipients. Suppose in a tablet, if you weigh it roughly, then it may be weighing about 1.5 gram or something, but it contains a very small quantity of the drug. That's known as the active pharmaceutical ingredient. In a tablet like crocin or any other tablets, there may be a 500 milligram of the active principle aspirin, but the excipients means they are the inert substances which make the binding up of the drug and also to make the bulk of and ease of administration. That's known as the excipients. Then there are once again so many dosage forms are there, liquid dosage forms, and once again in case of liquid dosage forms, monophasic liquid dosage forms and biphasic liquid dosage forms are there, and we will see what are all those things in the next coming slides. Especially they are given internally and also externally they are given. And now please have this particular slide as a snapshot and other thing, because this is the classification of the oral dosage forms. The first one is the liquids, means aqua elixir, emulsion, extract, gel, linctus, mixture, solution syrup, and tinctures. So these are all the liquids. So we will see what is the meaning of aqua, what is elixir, what is emulsion, etc. in future slides. And the second classification about the dosage form, in the oral dosage form, is the solids and semisolids. In the semisolids, once again, there are sub classifications. There are blocks, there are bolus, there are capsule, there are granules, pills, powder, and tablet. So you have to remember all these classifications very properly. Many times this will be asked as a 5 marks question. Please classify the dosage forms. So you better to remember this thing. Of course, this is taken from the Sandhu pharmacology book. Please, you better to have the HS Sandhu book as a reference book, because apart from the toxicology, entire pharmacology is there with very vast what you call as the explanation, etc. So that's a better book to purchase as your textbook. So I instructed you to purchase one Sims. How many of you have booked the Sims? Any person? How many? Still not? Anybody has booked the Sims? Oh, nobody is asking. So please, if you are not booked the Sims, please go to the Amazon and please have one Sims and Sinvex. And also, please purchase one book of this HS Sandhu with the latest edition, Veterinary Pharmacology and Therapeutics. That book, please purchase, because it's one of the worth book to purchase. Of course, the soft copy is not available. You can purchase that book and you can keep it in your own personal library. And parenteral dosage forms are once again classified into liquids and solids. The example, the liquids is injection and serum, and the solids implant and pellet. And we will see all these things. What is an implant? What is a pellet? And all these things. The inhalant dosage forms are the gases. Once again, in the gases, aerosol are there, gas and inhalant. These three are the sub-classifications. And the topical dosage forms means, the topical means applying over the skin, above the body. So over the body, the liquids, once again, liquids, solids, semisolids, and gases. These are all the three classifications present in this particular dosage form is concerned. The example is done is the dose, drops, enema, liniment. It is not liniment, it's a liniment. Lotion, paint and shampoos are coming under the liquid category. And once again, it's classified into solids and semisolids. So the cream is a semisolid, dusting powder, electuary, insufflation, jelly, ointment, paste, patch, plaster, poultice, sponge and suppository. These are all the sub-classifications in the topical dosage forms, especially solids and semisolids. And the gases, many sprays are there, just like the Volini spray is there, just like many examples we can give here. Enemas, all these things are present, especially in the examples. We'll see. So various type of the, once again, the dosage form is classified into the buccal dosage form. Buccal means inside the oral cavity, something can be kept and it is absorbed into the circulation. So the buccal dosage forms are classified into non-attachable delivery systems and muco-adhesive delivery systems. Two classifications are there. Once again, these especially non-attaching delivery systems, fast dissolving tablet, microporous fibers and chewing gum. So many of you have got the habit of having the chewing gum, and same can be applied here also. Once again, the muco-adhesive delivery systems are classified into solids, semisolids, patches and solutions. So in these solids, tablets, wafers, discs and powders. In the semisolids, adhesive gels, adhesive ointments, pastes, sponges and emulsions with adhesive properties. So once again, in patches, bilayered and multi-layered patches will be present. And solutions, mouthwashes, especially deodorant, mouthwashes and other things will be covering, and aerosol sprays. So these are all the classification in the buccal dosage forms. And the details are, this is a different way of the classification for ease of the remembering. Once again, this can be classed as the topical dosage forms can be classified into solid, liquid and once again semi-solid. In case of the solids, they are classified into powder, aerosol and plaster. Powder, aerosol and plaster. And in case of liquid, once again, they are classified into lotion, liniment, solution, emulsion, suspension and aerosol. This is the way how different books are going to classify. This is taken from the book Color Class of the Pharmacology, and different books classify this thing. Any one of the thing, in any dosage forms, there will be a solid form, there will be a liquid form, there is a semi-solid form is available. And hence, you can remember any one of these things and you can write it, there is no problem. So once again, another way of the classification is monophasic liquid dosage forms. So once again, it is classified into syrups, mixtures, elixirs and linctures. Same thing. Liquids, different books classified in a different manner, but please remember the classification as I have told earlier. This classification is always better, which is given in the H.S. Sandhu book. And now we will go in detail about the each dosage forms, especially the oral dosage forms. Oral dosage forms, first one is the liquid, as we have already dealt. And in the liquid, there is one dosage form known as the aqua, means it is a aromatic water. Aroma means a good odor or fragrance, or it's also a medicated water. And aqua is a weak and simple solution of volatile substances in water. Volatile means evaporative substances. It is mainly used as flavoring agent or vehicle. Example, peppermint water and camphor water. Peppermint water. So peppermint, I think many of you have tasted it. And also the camphor. Camphor is a volatile substance. It is dissolved into the water and it is going to be dispensed. In many of these what you call as the temples, in the form of the tirtha, it is given. Camphor is dissolved and it is given as the aqua. Aqua means aromatic water. The next category is the elixir. Elixir is an aromatic and sweetened hydraulic solution containing the dissolved drugs. Elixir is an aromatic. It's having the very good acceptable odor and sweet. It is also having some sweet. It is often used as vehicle to mask disagreeable and taste of certain drugs. Example, elixir cascara sagrada, because this cascara sagrada many times it is used in the carminative mixture etc. to the cattle, but it's very bitter in taste. So to make it a little acceptable orally, then it is having certain aroma and sweet is added. Then it is known as the elixir. Elixir. Then emulsion. Here you can see one person is doing some emulsion. That is the two, what you call as the immiscible liquid, means which cannot be mixed properly, oil and water. They are immiscible fluids in which one liquid is finely divided by trituration and uniformly distributed in other by means of emulsifying agent. Here one is emulsifying agent and another one is emulsifiable drug. So it is designed mainly to disguise the taste or oilness of the medicinal oils and to improve the absorption. For example, castor oil emulsion is used for topical preparation and also sometimes to give it orally, because this is not so easily miscible or dissolvable in water. Hence, it is mixed using a mortar and pestle. That's known as the emulsion. Extract is a concentrated liquid, semi-solid or solid preparation of plant or animal drug extracted with a suitable solvent. Whenever the extract is told, you have to remember that it is from plant. Extract is a concentrated liquid form of liquid, semi-solid or solid preparation from plants. Then, depending upon the consistency, extracts are following three subtypes. One is the liquid extract. So, the example is the liquid extract of belladonna. This belladonna is always used to reduce the diarrhea or to reduce the abdominal pain, belladonna. So, semi-solid or soft extracts, example is glycyrrhiza extract. It is a little bit sweet, and the extract means the active principles of this Glycyrrhiza glabra is extracted and made as a semi-solid extract. And solid or dry extracts are belladonna siccum extract. Belladonna siccum extract. So these are all the three dosage forms, especially in case of the extract. And gel. I think many of you have tasted the gel of especially diagen, gelusil and so many antacid forms. So I think you know it very well. Gel is an aqueous colloidal substance of the form of the in the form of the insoluble drugs, and it provides very good protective and soothing coating over inflamed mucosa and may also be considered suitable absorbent and antacid. So whenever there is a ulcers are present or erosions are present in the stomach, then to prevent the further damage in the stomach, these antacids are used, and to nullify the effect of the gastric hydrochloric acid also, the aluminum hydroxide gel. So many such preparations are, thousands of such preparations are also available in the market. That's why it's also the gel. And tinctures. It is a viscous and sweet preparation of the drugs having demulcent action. Demulcent means soothing action on the mucosa of the throat. If a person, I think nowadays, whenever there is a problem of the environment, there is a change, then you may be coughing. At that time, you will be given as the mixture, or it's a linctus. Linctus, it contains very high proportion of the syrup and sometimes the glycerin for the soothing effect of the throat. So especially it is used in the irritating cough, means unproductive cough. Whenever there is a person is suffering from the cough and other thing, then it is containing the drug, maybe many of the bronchodilators, antitussives, etc., then such linctus is given to those persons. Linctus means contains high proportion of syrup, and sometimes the glycerin, especially in case of cough, it is used. And mixture is a preparation in which the drugs are simply dissolved or suspended in water for oral administration. Mixture means carbonative mixture. So carbonative mixture is the one which reduces the froth formation and also stimulate the appetite in case of the animals. So here you can see that carbonative mixture is a mixture example of the mixture. The examples are the magnesium hydroxide mixture and many of the carbonative mixture. Here you can see that it is especially useful against certain antitussive mixtures. Suppose the animal is having a respiratory problem and it's having the bloat, etc., then carbonative mixtures are given. So whenever you are remembering the mixture, you can please see that the animal is having bloat and carbonative mixture is given. Here the carbonative mixture is given. Just I have put to remember, having the better remembering. This is magnesium hydroxide, etc., can be used. And syrup, it's a very common term. Anybody, whenever you are a kid and other things, so many syrups have been administered to you. So what is a syrup then? It is a liquid preparation of the drugs in which the vehicle is concentrated aqueous solution of sucrose or any other sugar. So simply saying, syrup is made to have more acceptability of a drug. So here the syrup like Benadryl, it's a syrup, cough syrup. So it is having more and more quantity of the sugar or sucrose. It's very, very sweet in taste. Means whenever the substance is having bitter taste, to make it more acceptable, this syrup is used. So this term is also has been used to include any other liquid oral dosage form that is prepared in a sweet and viscid vehicle, including oral suspension. And syrup may be a medicated syrup used as a stock solution, just like the Benadryl and the Corex and so many other cough syrups, and flavoring syrup used as a vehicle or flavoring agent, just like the lemon syrup. Some of the syrups do have the taste of lemon is added as in the sugar liquid, lemon is added as a flavoring agent. And many of the simple syrups are also do contain the flavoring agents as well as the sucrose. And what is a solution? Sometimes these definitions are asked in the exams also, but you should know what is, because later you are coming across with so many drugs. And since the practical classes we are unable to conduct through online, better to see at least the photos. Solution is a clear homogeneous preparation of non-volatile drugs dissolved in water or any other suitable solvent. For example, here you can see that a sodium chloride 0.9% is a solution, intravenous solution. Here it's a clear homogeneous preparation, and it's used for many purposes and by many routes. So oral solutions, this morphine hydrochloride solution and calciferol solutions. So many times this oral solutions, they will be also very clear. Apart from this were gels and other thing, very clear solutions are also available. Means water soluble substances are made as solution. And the parenteral solutions, the example is the sodium chloride solution, or it's also known as normal saline solution. Then the topical solutions, example is the iodine solution and hydrogen peroxide solution. Here also you can see the hydrogen peroxide, you might have seen, it's whenever it comes in contact with some dirt and other thing, the froth is going to be produced. So all these are having the clear, what you call as visibility, and just look like a water. Of course, the Lugol's iodine and other things are not clear, but they are the solutions. And tincture. So you have to remember all these things, especially tincture. It's a alcoholic or hydroalcoholic solution containing the active principles of the plant drugs or chemical substances. Here, one important thing to remember is in case of tinctures, it is alcoholic or hydroalcoholic, means in the water, alcohol is mixed, then the other drugs are dissolved. The best example for this is tincture belladonna and tincture digitalis. So tincture is very stable preparation that can be stored for a long time without decomposition, degradation or loss of potency due to preservative action of the alcohol in it. Here the alcohol is having antimicrobial property, antibacterial property, antifungal. So the drug can be stored for long time. For example, tincture belladonna and tincture digitalis. So these drugs can be stored, and you know the tincture iodine and many other things. And coming to the oral dosage forms, once again it's classified into solids and semisolids. You know, please remember the earlier classification as I have shown into the flow chart. The first one is the block. Even though you do not remember this classification formally, but whenever the terms like block, bolus, etc., you should remember the examples what I have given here. The block is a solid preparation, usually in the shape of square or rectangle containing nutrients or drugs meant for ingestion by licking. The example is the mineral mixture block. Especially in case of cattle practice, these are all the mineral mixture blocks, and these are tied in front of the cattle, and the cattle is going to lick it and get the minerals. So this block, especially these blocks, are very much specifically referred to the veterinary use is concerned. The bolus, or it's also known as ball, is a cylindrical mass of the drugs which weighs about 60 grams, measures about 2.14 inches, 2.14 inches and 14 inches. It's a big one diameter, and it's slightly tapering in nature. The stomachic boluses, many of the boluses, stomachic boluses, you can hear some of the 100-gram bolus. It's about 60 to 100 gram in nature. Some of they are made as a big bolus. Bolus is used for horses and cattle to provide large amount of the drugs required in a single dose. Suppose here another example what I can give is the sulfadimidine bolus. It is a 5 gram bolus is available, a huge bolus, because here the dose is more. So a bigger quantity is required. And capsule, everyone, you know, every day in your life, you are going to take one or the other capsules. Capsule, even though we know it, the definitions, etc., need to be known. What is present in a capsule? Capsule is an oral preparation consisting of a shell and filling containing a solid, liquid, or semi-solid drug. See here, this is a capsule. It's a oral preparation. Oral preparation consisting of external shell is there, and filling containing here some granules are present here. They may be solid inside this one. Some solids may be there. Some liquids may be also put, and semi-solid drugs may be there. But it's got a protective outer coat. The capsule shell may be composed of single shield enclosure or two halves. Usually there are two halves. I think whenever you see a capsule, you can see there are two halves which are made up of gelatin and fit together and are sometimes sealed with a band. And capsule shell is made from gelatin. All these are inert substances. These do not have any medicinal properties like gelatin, starch, cellulose, or other suitable materials. So here this is made up of gelatin usually, or otherwise also the starch and cellulose, which are not having any medicinal properties. And they have got the very hard shell for solid drugs, but they are going to dissolve very properly in case of the gastric fluid. And there are once again two types of the capsules are there. One is hard capsule, for example, amoxicillin capsule. Here you can see this is a hard capsule. Soft capsules are the vitamin E capsule. Here this is the vitamin E capsules and the shark liver oil, etc. capsules. They have got the soft capsules. You can press them also, just like some seeds. They do contain the drug inside. Whereas this one is hard, and whenever you are pressing, it feels hard. That's how the soft capsules and hard capsules. And the bolus, here you can see the albendazole. It's given in a bolus, 5 gram, 10 gram, 2.5 gram, etc. till 60 grams also. Sometimes the bolus are also prepared. And it's a large compressed tablet, usually rectangular in shape. So this is a bolus in shape, and large amount of drugs required in a single dose. So capsule, the examples are vitamin E, amoxicillin, coxacillin, so many type of the capsules are there. Here you can see hard gelatin capsules and soft gelatin capsules. Vitamin E and other preparation are soft in nature.